Hi, I'm Dr Annalene Weston, Dentolegal consultant at Dental Protection. Welcome to RiskBites, a series of podcasts created specifically for dental practitioners in Australia. RiskBites looks at the key dental legal risks and issues affecting dental practitioners across Australia and provides helpful advice and guidance on how to steer clear of them, leaving you free to provide safe and high-quality dental care for your patients. We'll be rolling out a mini-series within RiskBites this year called The Tipping Point. These case discussions are intended to identify and explore the moment in time when a patient moves from being disgruntled to actively becoming a complainant. In this edition, I'm joined by my colleague, Dr. Simon Parsons. So hi, Simon.
Hi, Annie.
Simon, in your experience as a dental legal consultant, I'm sure you've seen some cases where a dentist seems to have done everything right, yet the patient has still been disgruntled and complained. So I'm really curious to hear any examples you might have to share with us today.
Well, thanks, Annie. Yes, there's one that immediately springs to mind concerning a case where one of our members placed 6 veneers.
Yeah, it's funny you have that case in mind, Simon, because we do seem to be getting more and more complaints about veneers than ever before, don't we? So what happened in your case?
Well, our member, let's call him Dr. A, consulted with a patient whose primary concern was the appearance of her 6 upper anterior teeth, and they exhibited some erosion, chipping, and staining. Dr. A conducted a full discussion of the available options, including no immediate treatment, the advantages and disadvantages and costs of each option, and the patient agreed to proceed with composite resin veneers from the 1-3 to the 2-3. Dr. A then took models and sent them to a laboratory for a diagnostic wax-up of the proposed veneers. He showed these to the patient, transferred the proposed design to the mouth for a mock-up of the proposed appearance, and after a few small modifications, obtained the patient's approval to proceed. Dr. A then placed the composite veneers as agreed, performing minimal tooth preparation since the veneers were primarily additive in nature and they were there to restore mainly that lost tooth structure, including the incisal length. He took before and after photographs and the patient seemed very happy with the final result. Dr. A advised that, consistent with the original quote issued at the first consultation, a protective maxillary splint or night guard needed to be worn. He planned to take a scan for this at the veneer review appointment the following week after doing any small final adjustments that might need to be done. But the patient never returned for that appointment and therefore the splint was never made. Dr. A left the practice soon after this and never saw the patient again.
Okay, so far so good in one regard, but what happened then?
Well, a few months later, the patient returned to the practice with the corner of the veneer on tooth 2-1 chipped. This was repaired at no charge by the practice principal as a gesture of goodwill and to honour any implied warranty on Dr. A's past treatment. The patient was reminded that a splint was needed, consistent with Dr. A's original plan, and a new quote was printed. Again, though, the patient did not return for the splint to be made.
I think we can all see where this one's going.
Yep. Sometime soon afterwards, the same corner fractured again. The principal advised the patient that a splint needed to be worn and that this conversation had now been had several times and that unless one was made and then worn, any warranty on repairs was voided.
Yeah, and I'm guessing the patient wasn't particularly impressed about being told this.
Indeed, she was not, and she indicated that she felt Dr. A had provided extensive treatment, taken her money, but had basically abandoned her when she eventually developed any problems. She sought retreatment elsewhere, and she ended up having 10 porcelain veneers placed with somewhat invasive preparations at what someone calls a cosmetic dental practice. These apparently quickly chipped again, presumably because she was still not wearing a splint. The patient's original clinical presentation of having chipped teeth meant that it was likely that some parafunctional or strong functional forces were responsible for damage to her tooth structure in the past, with this perhaps still being an ongoing problem. So after having had all this treatment done, the patient remained angry with Dr. A, as she perceived that he had actually started the ball rolling, and a formal complaint against him was then made, seeking a refund of all treatment costs paid up to that point in time.
So, in this case, Simon, what are your views about what tipped the patient over the edge to then complain? Do you think it was the repeated fractures of the veneers, Dr. A's absence when the problems were encountered, or do you think it was something else?
Well, actually, that's a really interesting question, Annie. That's only something that the patient can really properly answer. I suspect that it wasn't Dr. A's absence that contributed in any real way to the escalation of this into a claim. I feel clinicians move practices all the time, and patients don't necessarily get irate if they need to see someone else, even if it is for continuation of treatment. But particularly when that new treating clinician honours any implied or actual arrangement that may have previously been in place.
Yeah, I agree. I mean, we often see issues after a practitioner leaves that are quite easily resolved by the new clinician.
Yes, we do. In this instance, it's much more likely that it was one of the other factors at play. The fact that one of the veneers chipped in the first place, the patient's refusal to own responsibility for this by having not complied with the plan to wear a splint, or something else. Perhaps she thought that the veneers would be trouble-free, that fractures only occurred to other people and wouldn't possibly happen to her. Perhaps this patient never wanted to have to wear a splint every night, as she thought them to be a passion killer, or simply thought it was being unnecessarily risk-averse to wear one, or even that it might be a strategy by Dr. A to gouge her for more money. We just don't really know for sure. But what we do know is that when she was reminded of this, she resented being told and decided to shift blame onto Dr. A. This was despite Dr. A correctly advising her from the very outset that the wearing of a splint would be necessary to protect her veneers.
Do you think perhaps Dr. A could have avoided this with a follow-up or a review appointment, maybe, Simon?
I do, Annie. I think if Dr. A had actually tried better to follow her up and then convince her to have a splint made, that may have changed the situation. Yes, a scan for a splint could have been done as soon as the veneers were polished at that treatment appointment. With the benefit of hindsight, we can nearly always do better, although neither of these two strategies might have guaranteed that the patient would have collected her splint, or even if she did collect it, then have worn it.
Indeed. To me, what I keep being reminded of is that there's ultimately a failure of consent and the patient's consequent lack of compliance.
Agreed. Dr. A might have been better off from the outset forewarning the patient that her veneers would fail unless a splint was worn nightly and could in fact chip from daytime use. He could have issued her with written information about those risks and had her agree to accept all risk for breakages if she failed to have a splint made or then failed to actually wear it. Or he could have simply decided to not treat her due to any reservations he may have had about her likely compliance and her history of past tooth wear.
Do you have some sort of wording that might have been helpful for Dr. A, Simon?
Yes, actually, in these sorts of situations, we may well want to ask our patients something like the following. Jill, you're going to have to wear a special guard over your teeth every night. Is this something you're prepared to do? Do you have any concerns about what it might involve? And can you tell me in your own words what you understand about what could happen if you don't have a splint made or you choose not to wear it? This sort of checking of a patient's understanding prior to any treatment ever being undertaken is crucial. It helps set the scene for what's to follow, who is responsible if failure of treatment ever occurs, and what can be done by the patient to optimise their investment in their teeth and minimise any risk.
We give our patients oral hygiene instruction when we issue a bridge or an implant crown because we know this is critical for long-term success. So in many ways, it's just an extension of that, isn't it?
It is. And we would really be better off checking before doing this treatment to see if a patient can maintain their current dentition. And usually we do this, as we know any new appliance will increase rather than decrease the load on them in terms of maintenance. Similarly, do we make a simple pull-down retainer before we embark on veneer treatment to test a patient's compliance with it and also help diagnose any ongoing nocturnal grinding? I really don't know. But what I do know is that even good, knowledgeable clinicians like Dr. A can come unstuck when a patient chooses to not comply with a full treatment plan. Our goal is to ask enough questions to weed out who those people are likely to be, and then re-educate them to be who we need them to be, if that's at all possible. This won't guarantee us a lifetime free of complaints, but I'm confident it will do a lot to help. And if a complaint is still forthcoming, I'm confident that the clinician will be in a good place to defend their treatment as being sound, safe, and clinically appropriate.
Yeah, I think so too. But I'm dying to know what the outcome was in Dr. A's case. What happened?
Well, Dental Protection assisted Dr. A with his response, emphasising what was originally planned and what actually occurred. I'm pleased to report that the patient ultimately withdrew her complaint.
Oh, that's magic. Thanks, Simon. And thank you all for joining us today. And we hope that you found this content helpful and relevant. And we look forward to sharing some more guidance with you in the future. If you like Dental Protection podcasts and you'd like to hear more, please subscribe and leave a review.